Hypertensive emergency treatment, resident edition. Commonly, this is a patient who did not realize they had hypertension, a person with hypertension but who has been non-compliant, or a dialysis patient who tends to be sensitive for BP fluctuations. Emergency is defined at 200 to 120. The goal is a slow, gradual decline for most situations. If the patient is stable and no concerning complaints, you can start with PO medications. Common choices are a dose of either clonidine, hydralazine, and Norvasc. A good dose to start with are 0.1 milligram of clonidine, 25 milligram of hydralazine, and 10 milligram of Norvasc. Remember to recheck your progress. In the ED or hospital, this step was started in the workup phase, but often it will require something stronger, so place an IV and get some labs. Some common bolus IV blood pressures meds are 25 milligram of hydralazine, 5 milligram of metoprolol, or 20 milligram of labetalol. It is common to try PO first, then a couple boluses of meds. If the patient is still elevated, then the next step is to place them on a drip and admit for further BP care. If your patient requires a drip, then admit them to ICU. Common nursing question will be, hey, the patient's BP is out of the danger zone. Do they still need to be on the drip? Answer is yes. If you take them off too early, they will likely have rebound elevation. So you will get a call at 1 a.m. that the patient is no longer teleappropriate, and now the one ICU bed is gone. Take my word for it. Anyway, back to infusion BP meds. The most common choice is cardine or nicardipine. For special situations, so as aortic dissection, the preferred choice is esmolol, but you can also use Vasotec. For CHF, nitroprusside can be considered if there are no contraindications. Reduction goal is over 24 hours if hypertensive urgency. Reduction goal is 25% within 2 hours, but keep the MAP above 100 in order to avoid hypoperfusion. Lastly, more med highlights. Use caution with using labetalol in asthmatics, someone on a stimulant like cocaine, or for someone with aortic regurgitation. Make sure your patient is not having an inferior STEMI. Before starting a nitro drip, hydralazine can raise the heart rate and is less predictable in how far it will drop the BP.